Healthcare technology is advancing at a rapid pace, transforming how we understand, diagnose, and treat diseases, enhancing patient outcomes, and improving the efficiency of healthcare systems globally. Innovations such as artificial intelligence, AI, wearable devices, telemedicine, and personalized medicine are just a few examples of how technology is reshaping the healthcare landscape. As these technologies continue to evolve, they hold the potential to address some of the biggest challenges in healthcare, including accessibility, affordability, and accuracy. This comprehensive exploration covers the current trends in healthcare technology, their implications, and the future directions these innovations are likely to take. Before starting, don't forget to like and subscribe to our channel for more future updates. Artificial intelligence and machine learning in healthcare. Artificial intelligence, AI, and machine learning, ML, have revolutionized various industries, and healthcare is no exception. AI-driven tools are being used for tasks ranging from predicting patient outcomes to diagnosing diseases. Diagnostic assistance, AI algorithms can analyze complex medical data, including imaging and pathology reports, to help doctors diagnose diseases more accurately. For instance, AI-driven image recognition tools are highly effective in detecting abnormalities in X-rays, MRIs, and CT scans, aiding in the early diagnosis of cancers and neurological disorders. Predictive analytics, machine learning models can predict patient outcomes based on historical data, which enables personalized treatment plans. For example, predictive analytics are used to forecast the likelihood of hospital readmissions, allowing healthcare providers to take preventive measures. Drug discovery and development, AI accelerates the drug discovery process by identifying potential compounds, predicting drug interactions, and optimizing clinical trial outcomes. This application has gained significance, especially in the rapid development of COVID-19 vaccines and treatments. Telemedicine and telehealth. Telemedicine has gained widespread acceptance, especially during the COVID-19 pandemic, when remote healthcare became essential. Telehealth encompasses a wide range of technologies and services that allow patients to receive medical care without visiting a healthcare facility in person. Increased accessibility. Telemedicine improves healthcare access for people in remote and underserved areas, where specialists may be limited. Patients can now consult doctors and specialists from their homes, reducing travel costs and time. Cost efficiency. Remote consultations reduce the need for physical facilities, making healthcare more affordable. By reducing the number of in-person visits, telemedicine also helps lower healthcare providers' operational costs. Continuous monitoring. Telehealth tools like remote patient monitoring allow healthcare providers to monitor chronic conditions in real time, enabling timely intervention if a patient's condition deteriorates. Wearable devices and remote patient monitoring. Wearable devices like smartwatches, fitness trackers, and biosensors have made it easier for individuals to monitor their health metrics, such as heart rate, physical activity, and sleep patterns. In healthcare, wearable technology is proving invaluable for monitoring patients remotely. Real-time health monitoring. Wearable devices collect continuous data, allowing healthcare providers to monitor patients' health status outside of the hospital. This is particularly useful for patients with chronic conditions, such as diabetes or heart disease. Early detection of health issues. Wearables equipped with advanced sensors can detect irregularities in a patient's health, such as abnormal heart rhythms, potentially alerting healthcare providers before a condition worsens. Enhanced patient engagement. Wearables encourage patients to take a proactive role in their health by giving them real-time data on their physical activity, heart rate, and other vital signs, promoting healthier habits. Personalized medicine and genomics. Personalized medicine, also known as precision medicine, tailors treatment plans to individual patients based on their genetic, environmental, and lifestyle factors. The field of genomics, which studies the human genome, plays a crucial role in personalized medicine. Targeted therapies. By understanding a patient's genetic makeup, healthcare providers can prescribe medications and treatments that are more likely to be effective and have fewer side effects. Cancer treatment. Personalized medicine has significantly impacted cancer treatment. By analyzing the genetic mutations within a tumor, doctors can develop targeted therapies that attack cancer cells while sparing healthy ones. Genetic testing and preventive care. Genetic testing helps identify individuals who are at risk for certain diseases, enabling preventive measures and early intervention. For instance, women with a BRCA1 or BRCA2 gene mutation can take preventive actions against breast and ovarian cancer. Robotics in healthcare. Robotic technology is transforming various aspects of healthcare, from surgeries to rehabilitation. Surgical robots, for example, allow for minimally invasive procedures, resulting in faster recovery times and fewer complications. Surgical assistance. Robotic surgical systems, such as the Da Vinci system, provide surgeons with enhanced precision, flexibility, and control, allowing for minimally invasive surgeries. These systems reduce patient recovery times and decrease the risk of infection. Rehabilitation and physical therapy. Robots are used in rehabilitation centers to assist patients with physical therapy exercises. Robotic exoskeletons help individuals with limited mobility regain movement and strength. Logistics and hospital assistance. Service robots help with tasks like delivering medication, cleaning rooms, and assisting in patient transport, freeing up healthcare staff to focus on patient care. Blockchain for data security and patient privacy. Blockchain technology, which provides secure and immutable data storage, has significant potential in healthcare for securing patient data and ensuring privacy. Data security. Blockchain's decentralized and encrypted nature makes it highly secure. This is especially important for protecting sensitive patient information and preventing data breaches. Interoperability. Blockchain allows different healthcare providers to access shared data securely, enhancing coordination and continuity of care across facilities and reducing redundant tests or procedures. Patient consent management. Patients can control access to their medical records using blockchain-based systems, allowing them to share specific parts of their medical history with healthcare providers or researchers as needed. Virtual reality, VR, and augmented reality, AR, in healthcare. VR and AR technologies are being utilized in healthcare for various purposes, including medical training, surgical planning, and patient therapy. Medical training and education. VR enables medical students and professionals to simulate surgeries and practice procedures in a risk-free environment. It allows for immersive learning experiences, leading to better retention and skill acquisition. Surgical assistance. AR can overlay digital information on a surgeon's field of view during procedures, providing real-time guidance and improving precision. This is particularly useful in complex surgeries where exact navigation is critical. Pain management and therapy. VR has been used in pain management and therapeutic settings, providing patients with immersive environments that reduce anxiety and discomfort during treatments. 3D printing in healthcare. 3D printing technology has made significant contributions to healthcare, offering personalized medical solutions and prosthetics that improve patients' quality of life. Customized implants and prosthetics. 3D printing enables the creation of custom-fitted implants, prosthetics, and even dental applications. This personalized approach improves comfort, functionality, and patient satisfaction. Surgical planning models. Surgeons use 3D printed models of patients' anatomy to plan complex surgeries. This practice enhances precision and reduces the likelihood of complications. Drug delivery and bioprinting. 3D printing is being used to create precise drug delivery systems and, in research settings, even print tissues and organs. This technology is still in its infancy but holds tremendous potential for future applications in regenerative medicine. Internet of Medical Things, IoT. and connected health. The Internet of Medical Things, IoT, involves a network of connected devices that collect and share health data in real time. Enhanced patient monitoring, IoT devices, such as wearable ECG monitors and glucose sensors, continuously monitor patient health metrics, allowing for real-time intervention. Data-driven insights, IoT provides valuable data that can improve patient care, enable early diagnosis, and facilitate long-term health management. Healthcare workflow optimization, IoT can streamline healthcare operations by automating tasks, monitoring equipment usage, and reducing wait times. This is it for today's video. What do you think of our video? Feel free to share your thoughts in the comment section below. Don't forget to like and subscribe to our channel for more future updates. Thanks for watching.